Hi, I'm Calaveras County Superintendent of Schools, Scott Nanik, and thank you for joining us today. I'm also a Rotarian with the Angels Murphy's Rotary Club, and this segment started off being a request of Chris Edgerly from Public Health to ask some questions for our club and to be a guest speaker. After reviewing the information, the Emergency Operations Center and myself and Public Health felt the information and questions being asked were highly important to our public. So with that, we're going to get into our session today, and I'd ask Chris to introduce himself and kind of explain what he's doing.
My name is Christopher Edgerly. I'm the Emergency Preparedness and Response Manager with Calaveras County Public Health Division. My job is to help all the responses from the county and get all of the material in from the state and the federal government in our COVID-19 pandemic response.
Thanks for joining us, Chris.
Thank you for inviting me.
We had some people ask some questions which we thought were important, and the first one up has to do when we start moving money around in the county.
Okay.
And how long does the virus live on money, and is there a good way to sterilize it?
The virus lives in anywhere between 2 to 3 days on money, and the best way to sterilize it is literally let it sit out in the sun, or if you have a UV light, you can actually sanitize it that way, or literally by laundering it. Put it in your pockets and put it in the wash.
That's true.
Yep.
Does it stay different on metal coins versus paper?
On paper, it stays longer. Metal coins only last maybe 3 to 4 hours.
Okay. Great to know, especially for our business owners who are anxious to get things going. I understand that testing in the county is extremely limited and basically being reserved for our first responders. Based on the governor's pledge to increase testing throughout the state, what is the status of testing in Calaveras County?
The status of testing in Calaveras County is not very limited per se. What was limited at the beginning of the testing was the actual reagents and the testing at the laboratories themselves. Calaveras County had even a smaller limited portion of the specimen collection kits. Now, unfortunately, we were just coming out of a very busy flu season. And because of that, it's the same specimen collection kits that we test for the flu that we also test for this virus. Now, that being said, we were able to get more specimen collection kits, and we're now able to ramp up our testing. Now, we actually have 4 priorities of testing groups. And the first is healthcare workers, the essential workers in the front line, such as our first responders, and those who are actually hospitalized with the virus. Those are the first people we test. Second priority group is asymptomatic or non-symptomatic first responders, other essential workers that may have been exposed and are waiting on quarantine. The third is other essential workers, such as in the public that we deal with banking, food supply, public health, public works. Those kind of people will actually get the third priority. Fourth priority group is actually the general public that is asymptomatic and or for surveillance purposes. So going forward in the county, that is exactly how we're prioritizing our testing. As far as their specimen collection. Most of the testing labs that we now have that we utilize is San Joaquin Public Health Lab, LabCorp, Quest, all these other additional labs that have been bringing up their testing capability. They're going to receive our testing kits, the collection specimen kits, and then being able to run the test. In the beginning, we were seeing 4 to 5 days in turnaround between the time we sent the specimen to the time we got the results. Now it's less than 24 hours.
Big improvement on those
Very big
tests.
improvement.
So that leads into, do we have any idea in the county how many people have been tested in reality?
We do have a count of how many results we've received back from people who live in Calaveras County who have been tested. And as of today, that's 323 people have been tested. And of those 323, we had 12 positive results. Of today, we have 8 of those are recovered, which is really good.
Great news.
Yes.
A question around testing, the antibody piece. Where can people get tested for antibodies?
Right now, nowhere here in California. That is still being rolled out. Supposed to be rolled out by the end of April. And once that comes to the laboratories that we're able to send testing to, then we'll be able to push that out to the public.
So hopefully late next week.
Late next week, we hope.
Good. Yeah. Who decided how many COVID-19 tests we got allocated to us in Calaveras County?
There was no allocation of tests to counties. What happened was a supply chain disruption on the specimen collection kits. So the testing kits that were developed and by the CDC initially and pushed to the public health care labs, there was enough of those. Some of them had some reagent issues and they couldn't use them, so they had to fix that issue. Our issue on our end was the specimen collection kits. Being able to physically take a nasal pharyngeal swab to the back of the nose, collect the virus, put it in the medium, and then send it to the lab. We had very few of those to begin with at Mark Twain Medical Center and the other clinics due to the active flu season. And let me tell you, when you have a very active flu season, you use the same exact testing kit, it's going to run roll on supply. So when it came time to order up supply, of course, it all been taken by other major labs and other major hospitals throughout the United States, especially in the hot spots, Los Angeles and New York and New Jersey.
So this one's kind of long, but we had somebody who expressed a concern that they have been told they probably have COVID-19, but to go home and self-isolate, we don't really have enough test kits because you're not in that super high-risk group. How are we ever going to find out how many of those were actually happening in the county and where we're at?
Well, now that we're increasing the testing, hopefully we will be able to catch those people. Now, a presumptive positive, which is probably exactly what happened in this case, the person did the right thing, went home, isolated, followed the doctor's orders, and if they got sick enough, they would come back or call their physician, come back to the facility, more likely Mark Twain Medical Center, they'd be admitted and tested at that time.
Okay.
So presumptive positives, we have a lot of those throughout the county. They're doing the right thing. They're going home, they're isolating, their symptoms are resolving. A lot of them have very little to no symptoms, believe it or not. So how they're getting to know that they actually have it is just basically on slighter symptoms or the fact that they knew somebody that they were exposed to. And that's being followed by the public health departments. Our contact tracing team is notifying some of these people who have been in contact with our known positive cases, and we're asking them to go get tested if they feel they've had these symptoms. Some of them are going without having symptoms, but want to get tested anyway, and we're discouraging that because of the smaller amount of test kits that we had. Now that we've ramped up that, we've purchased a bunch more, we're getting those out there, and we actually start to increase that testing.
Great. So part of that tracing thing, if you see a 754 number come up on your phone, you want to answer it?
You do want to answer it, yes. If you see a government phone number come up, okay, the 754 is our prefix. If you see that come up on your phone, please answer it. It could be from the public health department, contact tracing, letting you know that you've had a contact with somebody who has tested positive.
The next question kind of shifts to the mental health issue, and with beautiful days like this, we all want to be outside as much as possible. What are the ways in which we can help others deal with the isolation of the virus?
Reach out to them. If they're your neighbors or if you know them personally, see if there's anything you can get them, any shopping needs, any home needs around the house that you might be able to do and still keep the social distancing and still allow the isolation and quarantine to be in effect. There's a lot of household projects I know a lot of people are doing in this beautiful weather, and who wouldn't, but those who are sick need to remain inside and remain quarantined.
So back to testing a little bit. What is our game plan? How are we going to get more testing? Are we talking about a drive-through station at some point? Are we going to reach out to the public?
A very good question. We are having those discussions right now with our health officer, Dr. Dean Kaleda, along with the hospital actually this afternoon, and it's happening right as we're speaking here. So that conversation is happening as to how we're going to push out more tests, whether it be a drive-through clinic or open up a clinic just for testing, where people can come in and probably either drive up or someone will come out and swab their nose while they're sitting in their car. Those discussions are occurring right now so we can ramp up the production of testing. Okay,
and people you want to complete that test or currently have symptoms, right?
Right, symptomatic people who cannot explain out their illness any other way and their physician feels that they should be tested.
Okay, and they're going to need a physician referral to get that test?
They do not. It's helpful to have it, but if you don't have a personal physician and you know that you've had contact or you have these symptoms and they're not going away, you can come to the clinic anyway, but be sure you call ahead of time before you get there. And those numbers will be pushed out on all our websites and our social media.
And then speaking of numbers, at the end of this video will be a very important number, and that's the call center. Please reach out to our call center here at Calaveras County so they can answer your questions. They're our frontline contact information, and they can connect you with everybody else in the county that you need for assistance.
You can also contact the Public Health Department at 209-754-6460.
Thank you very much for your time today. I know you're a super busy guy, so we really appreciate it.
My pleasure.
A special thank you to Dave Dugan and the Bret Harte Theater Department for doing our video for us today.
Great job. Thank you very much.
Everybody stay safe, stay healthy, and wash those hands.
Wash those hands.